Hello students, today we will have lecture on antigen. So now we will see definition of antigen. So antigen is defined as any substance that satisfies two immunological properties, that is immunogenicity and antigenicity. So what is immunogenicity? It is ability of antigen to induce immune response in body. And what is antigenicity? It is ability of antigen to combine specifically with antibodies or T cell surface receptors. Then we will see epitope. So what is epitope? It is smallest unit of antigenicity. It is also called as antigenic determinant. And there are two types of antigenic determinants. One is sequential or it is linear and it is mostly seen in T cells. And second is conformational or non-sequential epitope. So it is mainly associated with the B cells. Types of antigen. So there are two types, complete antigen and incomplete antigen. So complete antigen, when it induces antibody formation, it is called as complete antigen. And incomplete antigen is also called as hapten. So it is incapable of induction of antibody formation. Now we will see incomplete antigen, that is hapten. So definition is they are low molecular weight molecules that lack immunogenicity but retain antigenicity. So there are two types again. One is simple hapten and second is complex hapten. So simple hapten is univalent, contain only one epitope, that is antigenic determinant. And complex hapten, it contains two or more epitopes. And haptens can become immunogenic when combined with larger protein molecule called carrier. Means they can produce antibody when they combine with the other protein molecules. Now we will see antigen-host relationship. So it is self or autoantigen. So belong to host itself. So that is that antigen is present inside the host body. Then non-self or it is also called as foreign antigen. That means it is present outside the host body. Then they are again of another different types. So first is alloantigen. So it is species specific antigens are called as alloantigen. This is when the antigens present in a species. Then isoantigen present only in subset of species. Example, blood group antigen, histocompatibility antigen. So they are called as isoantigen. Then heteroantigen. So antigens belong to two different species. Example, heterophile antigen. Now we will see in detail about heterophile antigen. So what is definition? It is type of heteroantigen that exists in unrelated species, that is different species. Antibody produced against antigen of one species can react with other. So the mechanism is used as a diagnostic application in few tests. So example of that is first is Will-Felix reaction. So it is used for the diagnosis of typhus fever. So in that antibodies against rickettsial antigen are detected by using cross-reacting protease antigens. Then second test is Paul-Bunel test. This is used for the diagnosis of infectious mononucleosis. So in these antibodies against Epstein-Barr virus, which is causing infectious mononucleosis disease. So these Epstein-Barr virus antigen are detected by using cross-reacting sheep RBC antigens. So these are two examples of heterophile antigen. Now we will see determinants of antigenicity. So what is antigenicity? We already saw it is property that makes substance antigenic. That means it combines with specifically with the antibodies. So there are factors depending on that the substance can become antigenic. So first is size. So large molecular weight, they are highly antigenic, and low molecular weight substances, they are less antigenic. Then second is a chemical nature. So proteins, polysaccharides, they are highly antigenic, and lipids, nucleic acid, they are less antigenic. Then third factor is a foreignness to host. So it is non-self. So they are immunogenic. Self, mostly they are not immunogenic. Then genetic factors. Then next is the optimal dose of antigen. Then next is the route of administration of antigen. So orally if you give antigen, then there is production of IgA antibody. In inhalation usually there is production of IgE antibody, and parenteral, that is intramuscular or IV, it is production of the IgG antibody. Then site of injection. So hepatitis B injection should be given in deltoid region because gluteal fat is there, and in that absence of APC means antigen processing cells are absent in that. So hepatitis B injection should be given in deltoid region. So site of injection is important factor. Then repeated dose of antigen. So they increase immune response. Then multiple antigens. So immune response is increased. In that adjuvant like action is there. Example of that is DPT vaccination. So in that pertussis act as an adjuvant. Then effect of prior administration of antibodies. So immune response is decreased. So example of that is RH immunization. So in that, if the Rh antibodies, the Rh immunoglobulin is given, then Rh antibodies are not produced, and then that is used in the treatment of the or prevention of the hemolytic disease of newborn. Now we'll see biological classes of antigens. So there are two types mainly depending mechanism of inducing antibody formation. So first is T cell dependent antigen. It is also called as TD. An example, all normal antigens are TD or T cell dependent antigens. Then second is T cell independent antigen. So it is also called as TI. So example, bacterial capsule, flagella or LPS, that is lipopolysaccharide, they are T cell independent antigens. And third type is super antigen. Now we'll see super antigen in detail. So definition, they are protein molecules that activate very large number of T cells irrespective of their antigenic specificity, and then they can cause disease. So we'll see examples of the super antigen and disease. So first is Staphylococcus aureus. So it has that enterotoxin which acts as a super antigen, and then it gives rise to disease like food poisoning, toxic shock syndrome. Then second example is group A Streptococcus. In that pyrogenic exotoxin is a super antigen, and then it causes disease like rheumatic heart disease. Then third is Epstein-Barr virus. In that Epstein-Barr virus antigen acts as a super antigen, and then it causes disease like B-cell lymphoma. Now we'll see in short about sequestrated antigen. So what is the definition? So certain self antigens are present in closed system and are not accessible to immune apparatus and are called sequestrated antigens or hidden antigens. So that means they are present in the body but they are in hidden form. So when they get exposed, then they cause reaction and then disease. So they are called as sequestrated antigen. So examples of few sequestrated antigen is first is lens antigen of eye. So it is enclosed in a capsule. So but while doing cataract surgery, if antigen leaks and then it causes immune response and then damage the lens of other eye. Then second is a sperms. So they are in hidden form. But if mumps infection is there and then in that the leak of the sperms is there, then that causes immune response and then that causes orchitis, that is inflammation of the testes. Then third example is thyroglobulin. So it is present in hidden form, but antibody to thyroglobulin is formed, and then that can cause disease like thyrotoxicosis or Graves' disease.
Hello students, let's study antibodies, that is immunoglobulins. What is antibody? Antibody is produced in response to antigens and they react with the antigen. They are protein, also immunoglobulins, part of gamma fraction of serum, found in circulating in blood, plasma, lymph or mucus or fixed to cells or tissues, and it protects against bacteria, exotoxins and viruses. So they are proteins synthesized by host in response to exposure to foreign substances. All antibodies are proteins. Antibodies are gamma globulins or immunoglobulins are produced by B lymphocytes, beta lymphocytes, that is plasma cells, and response to antigens. The structure of antibodies. Antibodies are gamma globulins with molecular weight of 1,50,000. Two pairs of polypeptide chains are there, one pair of heavy chain, one pair of light chain. Two halves are held together by disulfide bonds. The light chain and a part of heavy chain form one arm and remaining part of heavy chain form another arm. The light chain contains kappa, that is corn gold or lambda lapari. two regions are there, constant region and variable region. So the variable region end forms the amino terminal, that is FAB, and it is attached with the antigen binding site. The end constant, that is CH, it is carboxy end, it is also called FC. The hinge region is junction between CH1 and CH2, and it is sensitive to enzymatic digestion. Types of antibody is according to H chain, and it is designated by Greek letter. So the first is IgG, the H chain is gamma; IgM, the H chain is mu; then IgA, the H chain is alpha; IgD, H chain is delta; IgE, H chain is epsilon. First immunoglobulin is IgG, which constitutes about 70 to 80% of total immunoglobulins of the body. It has maximum daily production and highest serum concentration. The function: IgG can cross placenta, hence provide immunity to fetus and newborn. It is complement fixing, phagocytosis. This IgG plays a major role in neutralization of toxins. It is raised after a long time following infection and represents chronic or past infection. IgA, it is dimeric in nature. It has two monomeric units joined by a J chain. Secretory component: the location of IgA is found in body secretions like milk, saliva, tears, intestinal and respiratory tract mucosal secretions. Function: local or mucosal immunity. It is effective against bacteria like Salmonella, Vibrio, Neisseria, and viruses like polio, influenza. Breast milk is rich in secretory IgA and provides good protection to immature infant gut. IgM, the highest molecular weight and pentameric in structure. It present is only in the intravascular compartment and not in body fluids or secretions. Function: it represents acute infection, fetal immunity, protection against intravascular organisms, and mediate agglutination. IgE, it has affinity for the surface of tissue cells, mainly mast cells of the same species. It is extravascular in distribution, mediator of type 1 hypersensitivity. Ig is elevated in helminthic infections. IgD is found in membrane immunoglobulin on the surface of B cells and act as B cell receptor along with IgM. No other function is known for IgD so far. Abnormal immunoglobulins. So Baines-Jones proteins is one of that. It is found in multiple myeloma. It has many increased light chains of immunoglobulins. The cryoglobinemia, formation of gel or precipitate on cooling the serum, which redissolves on warming. It is seen in myeloma and SLE.
Hello students, welcome to this session. So let's study antigen-antibody reactions. So antigen-antibody reactions is the reaction between antigen and antibody, and in vitro it is also known as serological reaction. So what is the significance of antigen-antibody reaction? So it helps in diagnosis of infections, epidemiological survey, identification of infectious and non-infectious antigens. Types of serological or antigen antibody reactions are: first, they are divided into conventional and newer techniques. So conventional are precipitation, agglutination, complement fixation test, neutralization, and the newer techniques are immunofluorescence technique, enzyme immunoassay, that is ELISA, radioimmunoassay, immunochromatographic test. Now let's see about precipitation. So what is precipitation? When a soluble antigen combines with its antibody in presence of electrolytes, sodium chloride, at a suitable temperature and pH, the antigen-antibody complex forms is the insoluble precipitate. So it is called precipitation. And when instead of sedimenting, the precipitate remains suspended as floccule, the reaction is called flocculation. The mechanism of precipitation is called zone phenomenon. So when precipitation and some other serological reactions are by seen when antigen and antibody are mixed in an optimal or equivalent proportion. Since in this test antigen used is in fixed quantity, this only variable is the antibody. So serial dilutions of antibody when treated with antigen show that there is no precipitation where the antibody is in excess. So this is called Prozone phenomenon, and it is caused due to failure of the formation of the lattice. So lattice is proposed by the hypothesis is proposed by the Marek, and it is called lattice formation. So lattice formation takes place when the antigen and antibody are equal quantity. So when antigen in excess, so it is called pre-zone phenomenon, and when the antibody in excess, it is called the prozone phenomenon. So this is a diagrammatic representation. So in tube number 1 and 2 there is antibody excess. 3 and 4 there is an optimal proportion of antigen and antibody, and 4, 5 and 6 there is antigen excess. So there is no precipitation in antibody excess tubes and antigen excess tubes, but there is a proper lattice formation because of in the third and fourth tube because of the equivalent proportion of antigen and antibody, and there you can see the precipitation. Now let's see agglutination. So when a particulate antigen is mixed with its antibody in presence of electrolytes, sodium chloride at a suitable temperature and pH, the particles are clumped or agglutinated. It is called agglutination. It is more sensitive than precipitation for detection of antibodies. So precipitation, the application is VDRL test for diagnosis of syphilis, RPR test for diagnosis of syphilis, Elec gel precipitation test for the diagnosis of diphtheria toxin. And agglutination, there are many types. So direct agglutination for antigen detection. So it can be done by slide method and tube method. So slide agglutination is used for screening, that is Vidal test, blood grouping. Tube agglutination is used for confirmation, that is tube method by for Vidal test. Then indirect agglutination, so it is antibody detection. So passive agglutination, that is mediated by latex particles, so example ASO. And reverse passive, that is antigen detection, so latex agglutination, examples are RA and CRP. When RBC used as an antigen, it is called heme agglutination. Example Paul Bunnell test for Epstein-Barr virus, blood group, and Coombs test. So newer technique is ELISA, that is enzyme linked immunosorbent assay. So principle, the antigen and antibody forms complex with the enzyme, then substrate is added, so it activates chromogen and there is color change which is detected by the ELISA reader. So enzyme used is the peroxidase, immunosorbent used is the polystyrene or polyvinyl cups. Substrate is the hydrogen peroxide. The types of ELISA are direct ELISA to detect antigen, indirect ELISA to detect antibody, sandwich ELISA to detect antigen, competitive ELISA to detect antigen. So uses, it is sensitive test to detect antigen antibody reaction for HIV, hepatitis B, hepatitis E antigen, hepatitis C virus, NS1 dengue antigen, then Epstein-Barr virus, herpes simplex virus, toxoplasma. Advantages: test is specific, sensitive, large number of samples tested at one time. Disadvantage is the costly because the ELISA machine and ELISA reader is required. Fourth is the immunofluorescence assay. So principle, the fluorescence refers to absorbing high energy, shorter wavelength ultraviolet light rays by fluorescent compounds and in turn emitting visible light rays with low energy, longer wavelength. So fluorescent dye is used to conjugate the antibody, and such labeled antibody can be used to detect the antigen or antigen antibody complex on the cell surface. So types are direct, indirect, and flow cytometry. So flow cytometry is the laser-based technology that quantitatively analyzes and separates the cells as they pass through the laser beam, and it is used mostly for the CD4 T cell count in HIV infected patients. The application of immunofluorescence technique, detection of autoantibodies, that is anti-nuclear antibody in autoimmune disease, then detecting microbial antigen, rabies antigen in corneal smear, detection of viral antigen in cell lines inoculated with the specimen, flow cytometry used for the detection of CD4 T cell count in HIV patient, detection of leukocytes with specific markers for diagnosis of various lymphomas. Fifth is the immunochromatographic test. They are also called as rapid test because the result can be seen within half an hour, and they are also called point of care POC test because can be done in the routine OPD procedure. So there are two types, lateral flow and flow through. So lateral flow, it is a colloidal gold is used for labeling antibody, and then examples or applications are HBsAg test, dengue test, rapid malaria antigen test. And flow through assay, the protein A is used for labeling antibody, and method is the tridot. So it is application in HIV test for diagnosis of AIDS and HCV test for diagnosis of hepatitis C infection.
Hope you find this session useful for your understanding and for your exams. Thank you.